Hello, friends. Welcome to our another Facebook uh, discussion. Today's subject is related with the kids as well as adult. One is autism and one is ADHD. How Ayurvedic perspective in these two mental emotional issues. But the prime focus we will have it how what is the mother and father's role in that. Now, I'm sure many of you will be very much aware what autism is. When a child is born and his inability to interact with the other kids, being very sensitive, not able to have eye contact. Nowadays, this aspect of autism is considered as an autism spectrum. That's how when you take your child to doctor, that's how they will be classified because every child's signs and symptoms will vary. And in the ADHD also, as many of you must have seen, from the very young age, child inability to sit quiet, lack of concentration, focus is what ADHD comes up. But now, when you take it to your GP or even specialist, first thing what you get to hear is there is no treatment for that. And whatever the treatment they do, they just have different kind of behavior therapies or even down the track antidepressant, anti-anxieties, medicines, sleeping pill, those aspects start happening. But then question comes up. No one tell anyone, or even no matter whatever big books you read about these problems nowadays, no one tell you from where these problems comes up and then what role mother and father can play in getting their child better. So that's where I will talk about this issue. In fact, in general, reality is, and one day this will come up in front of the whole world, that these problems start from the time conception take place. And that's where the first role of a mother and father comes up. Nowadays, biggest problem in our society is that we never plan our pregnancies. When a couple is keen to look for to go and plan child, there is no planning. Just one day discussion between husband and wife, and then they think, okay, we might. Or sometime even that does not happen, and woman would be mother will only come to know that when she missed the period, and then she might get tested and found that she is pregnant. Before pregnancy, no planning is done, no mother or would-be father ever will look into their state of mind, their physical well-being, emotional well-being, surrounding their physical health, mental health, emotional health. Nothing is being discussed. Just going for conception and having conception by chance can be the first starting point in many which can build up certain imbalances. Because every one of us, whether Western medicine or Ayurvedic principles, we all know that that newborn which is getting developed in mother's womb will get everything from mother's body. All the mother's tissues will be responsible for developing that child's tissue, and including our brain part, even though no other science relate and talk about that how the soul comes, what is the role of the mind, senses. That's not something in any of the medicines talk about apart from Ayurveda. So I'm not going to touch on that. So that's one part. And then what should be mother's lifestyle, what should be mother's diet, how the mother's environment surrounding should be, what kind of activity she should play in all the 36 months, 36 weeks of the pregnancy. No one talk about that. Yes, to some extent, a little bit of prenatal classes, they can talk about that now you can give up your alcohol, now you can give up your smoking. If you are into even drugs, try to avoid. That is what the definition and the language is being used in those antenatal classes. Try to. Now, even after the conception, no one say full stop. You should not, you cannot. That is where you will find Ayurveda explain to everyone that such problem, whether it is autism, whether it is ADHD, even whether it is dyslexia kind of problem, every problem starts from mother's womb when she's not able to have a compatible lifestyle and all that what I share. And these things has been very, very in detail talked about in women and children's well-being part. That's why women's well-being program are very much key component in Ayurveda, because that's where your ultimate society is going to come. And if the society is not stable, ultimately it will impact your nation also. So how it can be done? That is where one aspect Ayurveda talk about, that there are specific practitioners who are trained in this kind of courses, where would be mother and father can go and have those get the guidance under them, and they in Ayurveda known as daima. So daima certified practitioner are trained to assess, give at least 3 to 6 month pre-program from conception, so that both can become more and more compatible. Then the whole every month's diet, lifestyle, mental, emotional state will be assessed by Daima's part. And then even the postnatal care is also talked about. So this is one aspect one need to look at. So role of Daima is huge to avoiding such problem, because we can, as an individual, can make habit, effort. That's what our focus is. And then see what outcomes come there. Now the second part is, say if someone has not done anything and most of the time not get done, especially in this part of the world, and the child is born. Now the child is born, and normally around 18 months or so, parents will start assessing that something is not good with my child. normal behavior, crying, communication, delay speech or other things, or walking even, sitting, eating food, all that part can come up with the autism aspect. Then they take to the doctor. Doctor will analyze, will put them into that classification that he look like into an autism spectrum. That's it. They will give something at the moment. You just need to watch and we'll see how slowly the child will grow. If there is too much violent behavior or discomforts are coming up in some children, they might give you some kind of remedies as a sedative, because that's one thing parent will always complain, he's or she's not sleeping, my child is not sleeping. But then neither the mom, neither the dad has any idea that how we should feed this child. Feed this child again, whatever they might be eating, all the stimulant will start from the very beginning. To a normal child, also every parent does, right? Whether it is your drinks, even we have seen many children come in clinic, they are on these kind of what we call as carbonated drinks, Coke, Pepsi. I should not say these things, but that's a part. And then look at starting their spreads like peanut butter, cheese is there, tomato sauce, and then because parents have the habits of having this smoothies, so half of the smoothies can go to the child also. All kind of stimulant, fast food, go to the get burger, get pizza, and then when you ask them, they will say, "Oh, I have only given one piece." One piece means, understand, one piece 3 days a week, where it will go in a 1 month even. And how the big child is, so even one piece will be more than enough for him or her. So that's the first part. Same is with the ADHD child. Now, ADHD child, their focus, attention, inability to concentrate is the key part. And all these stimulants, every doctor in the world, no matter whatever you relate with Western or these so many complementary medicine practitioners sitting out, everyone knows that these things are stimulant. But the problem is because those sort of things are their staple diet themselves, they never ever think that these can be contributory factor towards these children. And then with the ADHD, you will find most of the time children are very intelligent, because that's where there are a lot of questioning to everything, inquiry, another aspect comes up. And now when that child is bringing those kind of questions to the parent feel that I don't have the time, I'm coming tired from the office, then what they feel that my moral duty is to get him some kind of stuff, what we call as nowadays those computer games or your phone game, and they will open, even an 18-year-old child will hold in their hand to play on their phone all the games. And when you ask mother why this child is having that, he does not eat his food to feed him, I have to give that in the hand. And most of the time this is the common sort of scenario. Then with the autism part, parent will have no role, no understanding, no one tell them that how their communication, their role can make a huge difference. As I mentioned that those children are very sensitive, and if you see mother and father will be shouting at them not to do something, because that child will definitely do certain thing which that child has no idea. Something gets spelled, something is broken, something, and then mom and dad will start getting a bit upset with that. Child will not sit on table. They'd never think of that I should be putting more attention with the child. If mom is in a homestay mom and she is spending a lot of time, then father never take this responsibility that when he comes from office, his first job should be spend a lot of time with that child who is having autism issue. And then, because these children will always have one particular interest, whether to play with the sand, play with the water, want to look at making certain blocks or other things, different colors, attraction can come up. These things parent will never pick up and never try to spend time, which is the most important medicine. If whatever reason that child is born to them, their one prime focus of life should be that till the age of 8, 9, 10, my whole focus, my whole attention should be that child. But we in this part of the world nowadays, we will leave it that this is for those kind of therapists who will come, or I have to take my child every day or every second day to them. They will spend in a half an hour, 10 minutes, 15 minutes, because that is their job. That child is not there, so they will just tell them few things, and then they try to engage the child in their own ways, because they will always have 5 or 7 children around them. And parents will also feel that we are so satisfied that I'm doing this thing with my child, feeling that I'm doing my moral duty. But no, this is not the solution. Autism children can be made, can be reversed if you put your effort a lot in their all the activities, spending more and more time trying to repeat certain things in a way, right? Because as they will grow, they will not put their shoes, socks will be around. If we can slowly show them, pick up the shoe, put it there, all about your own patience. But when I am not patient, and when I'm not patient, why I'm not? Because if you look at my diet, my lifestyle, and if you tell them that you need to be careful, they will say, I don't have the autism. I don't have the ADHD. Why you are changing my diet? Here we go. They don't understand that their behavior is related with their diet and lifestyle. That is where the role of the habits and thoughts comes up. So Ayurveda looks into this bigger picture. And that's why we call it as a holistic program for autism and ADHD, which a Ayurvedic doctor can advise. And again, this is not a one day kind of issue. It can be a long term process. And if those mother and father can understand that how their role, their action, their deed, even their own communication between husband and wife can impact that little one who unfortunately is into this situation, which is again due to that mom and dad at the time of conception, and then the mother who is carrying on that child 9 months and not following the right kind of lifestyle and the diet and the mental aspect. In simple way, if I have to explain you, this is what we call as the wiring in your brain got affected. Certain wires are not being hooked at a right place. And then current flow is not happening properly. And that's the aspect we have to understand, and we need to look at what are the factors which are impacting that current flow, which is nothing but from one neuron to the other, messages getting part and how it get to those kind of situation. And then when, if a parent, father, mother can start making some effort, then that comes up role of that should I give him or her antidepressant, sleeping pill, or those kind of things. Not really. What you doing is, by giving those, you are trying to now suppress the nervous system function. It means coordination, which is already corrupted, will get more and more corrupted. Yes, you will very feel happy and satisfied my child is sleeping, right? And child is not aggressive. We don't think that what I'm doing is I'm putting in a pressure on that from these kind of drugs, right? Which is not letting, and the child will be totally, brain won't develop, and that's how the problems will keep getting more and more worse. Whereas in Ayurveda, we have very precise, specific Ayurvedic herbs which relate with the brain function, because again, even from the Western language, if you have to talk about, this is cognitive behavior disorders combinations. So to correct that cognitive function is what Ayurvedic herbs are, whether we talk about Brahmi, whether we talk about Malkangani, Jyotishmati, Bala, Kushmanda. There are so many herbs which play a huge role in developing and stabilizing, whether it is the autism child or whether it is the ADHD child. And those herbs can be given in a special way, even if the child is 2 year old. Ayurvedic special mixture, we call them as syrup, are prepared, which are palpable and can be given to those kids. One of the preparation is very, very precise, known as memorable. It comes up in a syrup. You can look at Surya Ayurveda's website. You will able to see, if you are in Australia and looking for something which we talked about. Then there is another preparation known as live life, because all what I mention about the food activities, they will develop more and more toxins in simple language. To mitigate that, that's where the live life syrup play a role. And now, because the child is agitative and lack of concentrations are happening, there is a one specific herb which comes in the form of drops known as mind ease oil. So you can start with 2 drops depending upon the age. If you are seeing an Ayurvedic doctor, he or she should be able to explain the right dosages. Otherwise, you can start with the 2 dose and you can increase it to 4 or 6, and try to give them once a day. That you can see by doing those preparation, whatever you are doing under the guidance of your doctor or taking to the therapist, you can still see the how much difference. And if all of you can start putting effort, even 1 extra hour, you can make a commitment with yourself that I will add 1 extra hour to look after this little one, guiding him or her with the few things which has been advised to me by Ayurvedic doctor, and then trying to keep yourself more calm. And that will only happen when you are composed, when you are in balance. Hence, you need to look at your habits, you need to look at your thoughts part, that how they are impacting you, and that will also create much more harmony in the family. And this is how you need to be very, very careful. Now, if a ADHD child is in your family, and 7 8 year old child or 9 year old child, and now you are sitting in front of him or her and drinking alcohol or wine every night, and then many of us will be smoking, Then few of us will be into marijuana kind of stuff, and that too again in front of the child. That's the bigger problem. And that child will pick up those habits. That child will naturally have that thought that this is okay. And then because that child has this issues and inability to identify the right and wrong, they can hook into these things very quickly the moment they get the chance. And then later on, parent will think, oh my goodness, my child got into now drugs or got into that. Who made them to get into? That is where we are as an adult, as a mother, as a father. This is our responsibility. And that's why people don't like to listen this, because they think that this doctor is accusing us. It's not about accusing. If you are coming to me, I should be 200% committed to your child and to you, to make a collective effort how we can help this little one. That should be our focus. And that should be, we should be mentally, emotionally prepared to invest in that child by making my changes and then making changes there. There is no magic pill, whether you go to a specialist in USA, Australia, or any country. Nothing is there. If something is there, it is only in the Ayurvedic approach. And that again, medicines are there, but if you will add the other component, lifestyle, diet, and how to deal with that child emotionally, mentally, that's where you will see the difference. And I will say, don't put years into that. Just think 3 months. And even with the 6 month period, if you don't see the changes in your child who is suffering from autism or have ADHD issues, you can always call me that look, what you mentioned does not work. You are not a right person to speak about. I will be very keen to discuss with you. But as long as you have followed the advice of that Ayurvedic practitioner who is giving you these all guideline, and that will only happen when a traditional Ayurvedic practitioners are there, because otherwise most of them just hook to sell their medicine. That's not what Ayurveda is all about. So that where I thought very briefly to share on these autism and ADHD issues. And from my side, which is not something I have created, this is the Ayurvedic principle that parents has to play a huge role in that. And even if you have missed that chance of getting pregnancy, not by chance, but with your thoughts, with your well informed analysis and decision, that can mitigate so much chances of having that situation. And then if the child is born, then make your life committed to that little one who unfortunately not in that stable state, but because of our actions, our decision, our habits, our thoughts. So let's think on that. Sit with yourself. If any one of you has that situation at home, so that you can create harmony for yourself, as well as you can play in a very positive role in stabilizing your child. Many families I have seen, not everyone, I won't say that, but even I have seen that when mom and dads are not in a balanced state themselves and they are going through a lot of pressure, this can act actually as a stimulant. And then one of them will say, I can't handle this situation, tata bye bye. And then their relationship get in trouble. So try to work on these things. These are all manageable and can be having a more better harmony in the family with the role of your one as a parent, mom and dad, and then the guidance of your Ayurvedic doctor can make life much easy. Thanks.